Today's episode is one that spans generations and emotions. Our guest has spent over 20 years working in oncology, standing beside countless patients and families through some of their most challenging moments. But cancer has also come knocking at her own door more than once. She lost her mother to ovarian cancer, a loss that reshaped her both personally and professionally. And now she's walking alongside her own daughter, who is currently in treatment for breast cancer. Through it all, she has carried the heart of a mother and a daughter. This is a story about what it means to fight cancer from every angle, and why hope, even in the darkest moments, can be the most powerful medicine of all. Sharon, thank you for joining Heather and I today. So you and I worked together a long, long time ago. I guess that was, 2010 to 2013.
Yep.
Then I left and went to Knoxville. And then I came back in 2019, and we had the privilege of working together for a number of years. And then, Heather, you and Sharon overlapped at the Proton Center.
We did, yeah, about 4 years.
4 years. So let's start. First question, what were your first thoughts when I walked back through the door in 2019?
I was saying, I know that guy. And was really happy that you were coming back, because I can remember that you used to come and sit in my office and we would,
And your role at that time was business analyst. What was your, when Sharon first met you?
His role was golf with the president. That's what I knew that he did.
That's what a business analyst does.
That's right.
Analyzes the president's golf game. So, yeah. But no, in all seriousness, though, Sharon, you have had a profound impact on me, just in terms from a mentorship role, just because of your experience in the field of oncology, and I know you've had a similar impact
Very much so, yeah.
on Heather. So, tell us what got you into oncology.
Well, I didn't actually work in oncology until I moved to Oklahoma about 25 years ago. In fact, it was January of 2000. And when we moved here from Louisiana, I got a job at Baptist Hospital on the oncology floor, which was 7 West at the time. And so that was the beginning. I was just a ward clerk. I got really close to the physicians there.
How old are you at this time?
I was 40.
Okay.
I think I turned 41, yes, in 2000, January 2000. And so when 4 of the doctors decided they wanted to go and have their own practice, they invited me to come with them. And after working at Baptist probably 2.5, 3 years, I went with them, and that was Cancer Specialists of Oklahoma with Dr. Choma, Dr. Chohan,
Great.
Dr. Holland, and Greg Parker. And then I worked with them for, I think, about 8 or 9 years. And then there was a couple of nurses that worked at the Proton Center, and they said, we need somebody to fill in this position that we have open, and they can't seem to find anybody. They're trying. And so I applied for that, and I got that job, and the rest is history.
So tell us about your motivation for getting into oncology. I think you'd had a personal experience with cancer.
I did. My mom, when I was really young, I probably was about 25 or 26 years old when she was diagnosed with uterine cancer. She initially had this terrible pain in her abdomen, and we brought her to different doctors, to try to figure out what it was. Nobody knew. Finally, she went back to her old gynecologist, who did an exam and said, you have a big mass in your uterus, and that's what's causing all your pain. So when she had the surgery, and I guess they biopsy, I was so young, I didn't really.
And had young kids at the time.
3
and
little
you're a
ones.
Mom of 3, and you're trying to deal with that, but also deal with this diagnosis of your own mother.
I was in college.
Okay.
going to nursing school.
Right.
Yeah. So she, when they did the biopsy, it came back, she had uterine cancer. So then she went through treatment and was in remission for a year. She had chemo, radiation. I mean, they blasted her with it. You know, it wasn't like it is today. And of course, protons, as far as we knew, was not available. And it came back, recurred, and it was in her liver. So then,
what was that time frame from when
she was in remission a year. So she probably was sick a year with the cancer, going through treatments, and got better a year. So, and then she died a year later. So it was a total of 3 years from diagnosis to when she passed away. She was 47 years old.
Wow, young.
What
very,
stage
very
was that
young.
at diagnosis?
So she was 44.
And stage?
Oh, I'm sorry, stage. I don't remember that. I don't remember that. You know, when I was that young, of course, you know,
it's
you don't know what you're doing
and you
with your own
probably
life, you
try
know.
you block a lot of it
Right.
out too because it's painful.
It's very painful and confusing because my mom had always been very healthy. There was never any health issues with my dad. I mean, he was a truck driver, so he had a lot of back surgeries because there was no ergonomic seats for trucks back then. You know, it was just bouncing around and you loaded and unloaded your own truck, you know, so.
Well, I think
but
about
other
this
than
too.
that,
You're a mom of 3, and I am a mom of 3 also. I think I need my mom. I need her advice. I need this person to walk with me through this journey of motherhood. And then you're kind of faced with that at such a young age, 26 years old. There's so many more milestones that you will have, that your kids will have, whether it's like going to kindergarten, going to college, going, you know, getting married, all those big milestones that you want your parents there for. You're kind of faced with that at 26 years old. And so, yeah, I can't imagine that was easy.
Well, I was very headstrong back then, and I got married very young. And so I was still in the stage of trying to prove that I didn't need anybody to tell me what to do. I didn't want to ask any questions. I mean, it wasn't until after my mom was gone for a few years that I was like, oh man, I need somebody. And I was the oldest daughter. You know, I had 2 siblings under me, but I had no one to ask, you know. So that was the thing that I missed really the most. But, and now, you know, I think to myself, if only we would have had appropriate screening, you know, imaging that could see what was going on, but we didn't, you know.
So what was your role with your mom as she was going through treatment? Were you a caretaker? Were you helping make treatment decisions? Were you?
No.
Yeah.
I was not. I was a caretaker in so much as my brother was 12 years old when she was diagnosed. So I took care of my brother.
Second mom to your brother, right?
Yes. When she wasn't cooking, unable to prepare meals, I did that sort of thing. But don't forget, I was in nursing school.
Right.
So besides taking care of my kids, I was trying to do what I could, which was not enough, but it was all I could do, you know. My sister didn't live there anymore. My brother was little, you know, 12 years old.
You're the oldest child. You carry the weight, right,
of everything.
Making
You
those
have
decisions.
to, and then my brother stayed with us a lot, you know, because my mom was sick. My dad did a great job taking care of her. He was retired, but my little brother was like my 4th kid, except he was considerably older. And, you know, I mean, it was a financial burden on my family, on my immediate family with my husband and my 3 kids, because I was in college. I had all these kids. And, you know, to add a growing teenage boy to your family, you know, I mean, it's remarkable.
Yeah. Right.
that I made it
That's
through
your
without
fourth
hurting
child,
someone.
though, right?
Yeah.
So you carried this can-do attitude and just kind of spirit of perseverance into your career in oncology. What else? How did your experience with your mom shape the way that you approached your job when you did start working for the at Baptist and then ultimately with the medical oncologists?
Well, I'll tell you what I remembered the most when I started working with cancer patients was compassion. And I mean, I was tough when I was at home because I was strict, I was trying to keep everybody in line and doing what they were supposed to do. But when I moved here, my kids were mostly grown. My baby was like 16, and I started working with these cancer patients. I was at the front desk at Cancer Specialist, and one of the phlebotomists there told me after a patient had come and just ripped me a new one for something. I can't remember what it was. But, you sit back, and after he sits down and everything, you're kind of teary-eyed and you don't know what to do.
Right.
So he told me, he said, don't forget that these guys have cancer. You don't have cancer. They have cancer. And they're going to have some bad days.
There's a lot of perspective, right?
Yeah, and then I was like, it was like a switch was flipped, in my brain. And it just changed everything, I think, that I did, not only at work, but at home. And, you learn to, when a patient comes in, it made me put myself in their place so that I could understand, what they're feeling. And I think that was a lot of feelings and emotions that I brought with me to the intake office at the Proton Center, was that, don't forget, they haven't worked in oncology all these years like you have. They know nothing about it. So it's up to you, or the job is, I didn't feel like it was up to me. I felt like it was everybody's responsibility to make sure that you take care of these patients, you explain things to them in a way that they can understand it, and let them tell you how they feel and take that,
But you especially, you are the first phone call. You're that first point of contact for these people. And so the role that you had there was, it led to them speaking to everybody else. You were
and
first.
I took that responsibility very seriously too. I thought it was so important to do that.
Well, I think also too, Heather, I know we've both taken turns sitting outside Sharon's office, or having our office close to her office. So we've had the privilege to listen in on some of the phone calls. One of the things that's always struck me is that I think that there's some patients there's just so much uncertainty and everything is so overwhelming. There's so much new information that they actually need a little bit of decisiveness. They need a little bit. It's almost like or maybe encouragement is another word. And I always thought that you were really good at that. Like,
empowering them to make these decisions.
Like, hey, look, this is what needs to happen, and we're going to get this done, and I'm going to make sure that this gets done for you.
And you get it done.
I can remember one guy called me like he couldn't decide. He was a prostate cancer patient, and he'd gotten all this misinformation from his own doctor, I might add, that, protons is just experimental, and, it doesn't really work. It's just a new fad, that and so talking to this guy, and I'd give him all the information I could. I mailed him brochures. I invited him to talk to one of our physicians, several things. Finally, after like 5 or 6 things, and he called me back, and I said, look, you're going to have to either pee or get off the pot. You know that you have cancer.
Yeah.
So now what do? You got to do something about it. So let's do it.
What was the hardest part of running the intake department at the Oklahoma Proton Center?
I think the hardest
And don't
part...
say management. You can't say management.
David.
Of course not. It was David.
Yeah.
No, the hardest part for me was trying to help people that were not educated about treatment options,
Right.
no matter what their disease was, because they had a professional telling them one thing and somebody else telling them to do something else. Or I never understood this, and this is another funny one, when a guy said, well, a doctor said that my prostate cancer, it's very small, and we're just going to we're not going to do anything. We're just going to keep an eye on it.
Watch
and
and wait.
I'm like, are you going to just wait for it to get bigger? And so we have to treat you more? I mean, you tell me if that makes sense to you.
Yeah.
What is the narrative behind
Waiting?
waiting and watching and waiting, or we hear
Active
this?
surveillance or
Yeah.
watchful
What
waiting.
is that?
Yeah, I mean, I think, there's a point where cancer maybe is caught early enough, and you talked about the importance of screening, where we are able to say, okay, we don't necessarily have to do any type of intervention right now. We can keep an eye on this cancer. And especially with something like prostate cancer, there's actually a lot of guys that are going to get old and pass away of something else, even old age, without the prostate cancer spreading outside of the prostate. But there's also, I think usually by the time somebody is contacting a place like the Oklahoma Proton Center, they've probably had a recommendation that they need intervention, that they need treatment. And so to your point, it's like,
mostly.
okay,
Mostly, that was true.
But also patients can get overwhelmed with how many treatment options that there are.
Right.
And so then you get decision paralysis. Well, I don't know what to do.
Right.
Is there a wrong answer? Is there a right answer?
And
how
who
would
should
you
I
answer
listen
that
to?
question?
Right.
Yeah.
Because you want to trust your doctor, right?
That's right.
Yeah.
And I would say, if you, a patient that said there was all these different options and I don't know which one to pick, I would try to go over with them, because we had good information that the doctors that you had written up for me, showing me or saying showing the difference between each one, But to be honest, a lot of patients would call and say, I had a friend who had prostate cancer and they took his prostate out and now he has to wear, incontinence briefs, and I don't want that to happen, So things like that too, because I don't know if it's all over the country or just in Oklahoma, but word of mouth is a big deal here. Yeah. And people trust their friends, they trust their family members to share their experience.
Their experience, right? They,
yes.
for the most part, all had great experiences at the Proton Center. You want to
That's
tell your
right.
friends.
That's right. And also a great tool that we had was we would say, I have a man, he's a patient here. He's already finished with his treatment. He's been out of treatment for 6 months, and he says he would be happy to talk to you, and you could ask him whatever questions you wanted to. Patients really responded well to that because they knew they could talk to someone who'd been through it already.
So we treat a lot of different cancers at the Proton Center. We definitely treat prostate cancer is one of them, breast cancer, lung cancer, head and neck cancer, brain cancer. But you got the opportunity to have a lot of very intimate and personal conversations with potential prostate cancer patients. I think that is one of the things that, that made it a little bit worth coming into work for me, is to get to listen to you take the really challenging or awkward questions from the guys that are like, what is about to happen to me?
Yeah.
Yeah.
And I think
That's a question for your doctor.
Yeah.
sometimes you did have to say that, or ask your wife.
Yeah.
But I would tell them, a lot of them I would only answer questions about treatment or prostate cancer because and again, I know that we treat a lot more than that now. When I started, it was a lot of prostate patients. That was the cancer that a lot of people were treating with protons. So that's the most of the calls that I got. But I think that it's not hard to talk about something like that on the phone,
Oh, as long as you don't have to see them in person.
Well, it was okay with me
Yeah.
because I talked to people about it all day long. But for them, it was easy for them to pose questions to me on the phone.
Yeah, you're not making eye contact.
Yeah, I mean, I had a very few patients that was, kind of, I wouldn't say it was inappropriate. It was just kind of really
pushing the
raw,
boundaries, so
Yeah.
to speak.
and
Yeah.
yeah.
TMI.
Yeah, and
You know.
sometimes, but I mean, at the same
But
time, those are legitimate questions.
They're
too,
legitimate
right?
questions. I mean, when you have a 75-year-old man saying something's wrong with my pee-pee,
Yeah.
you know, you want
Yeah.
to say, okay,
I'm sorry.
let me give you the number.
We can, yeah, we will.
So,
This is a
and that
great
was
question
nice
for your
too,
doctor.
having the information for them. They felt so much better when you said, oh, I know a urologist practice that has several urologists there. You can call, tell them I told you to call, so that they'll take care of you right away, and you can talk to a urologist about any other kind of problems that you're having.
Yeah, and that's important. So I want to switch gears just a little bit because I think it's important for the people that are listening to get to know you, Sharon, a little bit outside of the work setting. And we've obviously talked about you as the caretaker with your mom, and then we'll talk about your most recent experience as a caretaker with a family member going through cancer. But there's two things that I've loved to hear you talk about. One is your family reunions
Okay.
out in, is it Tallahassee?
Tallahassee. Well, it's in Albion,
Albion.
Oklahoma, but
Okay.
nobody really knows where Albion is.
So
It's
this is
Tallahassee.
like this to me is like a flashback to another era almost. Describe a setting at a Followill
Family
and all
follies.
the family reunion in Albion.
Okay. Well, to
And-
begin
and
with,
don't hold anything back.
uh-oh.
Yeah.
Or maybe you
Y'all
should.
heard him.
I don't know.
Y'all heard him tell me not to hold back.
Yeah.
Well, in the beginning, when I first married Chris, they were already having family reunions, but they were just doing it at different places, like they rented places at Beaver's Bend and Dry Creek and which I, of course, had never heard of anything like this before. In my neck of the woods, down South Louisiana, we didn't have 6 and 7 kids. I didn't even know anyone that had 6 kids, We had 2 or 3 kids, So I had a total of 6 cousins on both sides of the family.
Yeah.
Right.
So it wasn't big like this. So I was thrilled to death to show up, and all of these people that were Chris's cousins, and aunts and uncles and grandmothers, and
Brothers,
it would be like 100 people on a bad year, And so eventually, one of Chris's uncles, he donated some of the land. He said, I want this part of this land to be for family reunion, because that way we can stop going to all these places, and we'd have our own place. And it was his Uncle Kenneth. So they started, we still lived in Louisiana, so Chris's parents and uncles and aunts, they started working on that property and clearing it out. And people would bring tents the first year, and then travel trailers sometimes, And then they got the idea that, hey, why don't we just all build us a little cabin? Nothing fancy, just some place to get out of the weather, And they built a big shower house, is what they called it. And it had a women's side and a men's side. And it had 2 showers each side and 2 potties on each side. So it was
Camp Followill.
You can't follow well. It was like going to the lake somewhere,
Right.
where you went when you were a teenager,
Right.
But it eventually, it just kept growing, and we bought the 5 acres behind the property that attached to it. So because we were running out of room,
Right.
So now it's like every year we have at least 98 or 100 people, but a lot of times we have over that. We have had 150 people, but it's all people that are related, and we cook food and play horseshoes.
How do you cook for that many people?
Well, we've got these big giant barbecue pits, smokers. Everybody's got their own little setup that they cook, whatever you cook to bring to the center. Chris's other uncle actually had built a big giant pavilion where we have certain meals, and then we all bring our food together under that pavilion and sit together and eat. And it's actually supposed to be Friday night, Saturday, Sunday, and then Monday, Memorial Day, everybody usually goes home. But the Followills and a few others stay the whole week afterward. And we swim and we fish and we play games. It's the best thing.
You're swimming in it.
Ever.
It's like a big nice pool, 5-star.
No pools, no glamming.
Yeah.
It's
river.
And we get down there and we're like, oh, Walnut Creek is not up. We're going to have to walk a little further down to get in some water. So.
And then you just sit in the water.
And you just sit in the water when it's not deep enough to swim. Just bring your lawn chair and your cooler, and
I love it.
I wouldn't miss it for the world.
Yeah, no, it's really
wonderful.
Fun. It's really fun seeing those pictures.
It speaks a lot about too your love of family and get-togethers and making that a priority.
And we go there. We go there even on other weekends. About 20 of us will say, "Hey, we're going to the cabins this weekend," and you may have 20 people, you may have 50 people show up, and just it's a pretty cool thing.
Have you incorporated some of your Cajun roots from Louisiana?
I have.
The cooking and
We typically will make gumbo on Friday evening.
Okay.
When we
the
get
gumbo.
there.
It's delicious.
The gumbo's amazing. Yeah.
And then
Out of this
Tyson
world.
sometimes will make red beans and rice, or he'll make chicken and sausage fettuccine or something that's real spicy. Everybody likes it. But
So I read a story back, this is maybe 10 years ago-ish, maybe 15, I can't remember. It was in the Rolling Stone magazine, and it was about, it was a narrative of the band The Kings of Leon. And in the interview, they talked a little bit about going to a family reunion on a regular basis that sounds a lot like what you're describing.
really,
It does, yes. And what's interesting is that the guys in that band have the same last name as you.
that is interesting.
Is there any connection?
Huh?
Is that
She'll
just a
never
random
tell.
coincidence? Yeah.
I've heard that too. I read the article.
Well, is it true? Everything in the article?
It is true.
Ish.
Yeah, it is
Ish.
true. The Kings of Leon, those 4 boys are my nephews.
They're your nephews. Okay.
They're my husband's brother's boys that are in
Okay.
the band. And my son, he's been working with them since they were all in their early 20s
Yeah, and so
and are still together.
and
today.
are back out on tour. New album last year. New song with Zach Bryan.
Yeah.
That just came out a couple days ago. Do you? What was it like with the whole family there? But what was it kind of like with? I mean, a lot of people know the Kings of Leon. What were they like coming to the family reunions growing up? I mean, you were a little bit like a mother figure to them, I think.
Well, after their mom passed away from COVID, huge loss in my life because she was a really good friend to me.
Betty
Because
Ann.
we both married those Followill boys around the same time. So we were pretty good friends. And I don't know, they would come and stay with us, in the summers, and we had pallets on the floor for all those kids. You got 6 kids laying in the living room. I mean, it was tough, but it was fun at the same time. So they did grow up. I mean, I feel like I would do just about anything for them.
What a great influence, though, for you.
Yeah.
I mean, I know the influence that you've had on me. So if I had that at a young age.
Well, I'll tell you, for the first probably 4 or 5 shows that they did here in Oklahoma City, I had gumbo. I brought big, giant pots of gumbo and fed the crew. And after that, but then the crew got to where it was like 150 people on the crew.
Yeah, there were more people on the crew than were coming to the Followill family reunion, and that's where you drew the line.
I just was
and
like,
said,
I can't do it anymore.
When you guys were all growing up together, your kids, them, were you thinking, Nathan and Caleb and those guys, you're like, well, this world famous rock band, this is.
No.
You saw that when they were 8, 9, 10.
know?
They probably don't even think that, though.
Yeah.
You never know.
I don't think so. I don't know. Maybe they did. I do remember that those 3 boys, it was Nathan and Caleb and Christopher, my son, they were all pretty close, growing up as teenagers. And they all said Christopher, if you get a baseball contract, you take care of us. And if we get a rock band, we'll take care of you. And they always said that. And they actually did, you know, that they went on to work together and be successful. And I'm really proud of them.
I love that.
Yeah, it's great. And I do love the new song with Zach Bryan, The Bowery. I know, Heather, you...
I'm a big fan.
Yeah.
Big fan.
Yeah.
All of them, but so.
Yeah. What are you hoping that, or what do you hope for that band, for Kings of Leon? I guess, are they going back out on tour? And
I don't know, really.
They've done a couple big stadium shows.
Yeah, I don't know really that much about them, but you know what I hope? I hope they just all come home.
Yeah.
That's what I would like to see.
There you
I
go.
would like for them all just to
come back
home.
to Aunt Sharon and let's live here in Oklahoma and do family reunions. Yeah, that's neat. That's fun.
But I tell you what, that's hard to do when you come to your family reunion and there's 100 people that you've never seen before in your life, and nobody else has ever seen them either. Because this is not it's not a gated community, you know. It's out in the open, out in the country. I mean, anybody could show up.
It's possible that people show up to the Followill family reunion that are not actually family.
So if I showed up one year, would you vouch for me, or are you kicking me to the curb?
You just give them my name, baby. You can come in.
Yeah.
So I want to segue back to what we talked about a little bit earlier, which is this journey that you've gone on in the field of oncology as a caretaker, a little bit as a caretaker for a lot of patients coming to the Proton Center, and then, of course, with Cancer Specialists of Oklahoma. But then for the last year or so, as a caretaker for your daughter, Jandy.
Right.
What was that moment like as everything was going down and you're thinking, my daughter may have cancer?
It was horrible. It was just horrible. I mean, when she went, because she had a patch of skin underneath her left breast that was just kind of dry and scaly, you know. And so her primary care doctor made an appointment for her to have a mammogram and an ultrasound, just to be sure, you know. And of course, I didn't know too much about different types of breast
you hear
cancers.
About a lump or feelings, so
Right.
you don't think so much about it being
No,
a
you don't
patch on
think.
the outside
No,
of the breast.
we didn't think nothing about it because she was very. Every time she took a shower, she did a breast exam. She was she kept up with that. She never let it slide. I mean, she was just really, she kept up with it. You know, she didn't let that kind of stuff get out of control because she wanted to be sure, you know, like we all do, women do. And so, believe it or not, because we were like, oh, well, it's dermatological. That's what I thought too. It's just some skin, something, you know. And so for 3 months, she didn't have an appointment. No appointment. Nobody called. If I could do that over again, I would call and say, 3 months is not acceptable. You know, we're going to, and of course, later, Jandy's oncologist said, I wish you would have just called us, you know, but you're thinking it's nothing.
Right.
But then,
well, you think too, filling out forms, do you have a family history of X, Y, Z?
Yes,
no
I do, family history of breast cancer.
But her
grandma had uterine cancer, which is a female cancer.
Right.
But you don't think like that, you know. You think, because that's what people ask you. Doctors will ask you, do you have a family history of breast cancer? No, none whatsoever. So she had that screening done, and I mean the ultrasound, the mammogram, and we went. I immediately wanted to go to some of my resources, like Dr. Toma, who I had worked for all those years.
She's a medical oncologist.
She's a medical oncologist in Oklahoma City. She was a part of the Oklahoma Cancer Specialists of Oklahoma, that group. So I drove there, called them, and they said, bring her right in the door, and we're going to check this out. And so they did.
We should mention, too, you have newly retired at this point.
Right.
So
Yeah.
you're no longer
Yeah,
at the Proton Center.
That's
at
right.
How long was that from retirement to Jandy's diagnosis?
Probably not quite a year.
Okay.
Not quite a year I had been retired from the Proton Center. But then we had a biopsy done, and then that's when Jandy's insurance said, you can't go to Integris. You have to go to Mercy.
Mm-hmm.
So we did, and which turned out to be great. We went to Dr. Bova. She, we knew that she had breast cancer from that biopsy. And when she called me, of course, I just said, that's okay, because treatment these days are great. We're just going to go in there, and who knows, you may just have to have surgery.
Mm-hmm.
I didn't know, but that's what I thought maybe,
Right.
To her, this is what I was saying. And so we hung up, and of course I fell on the floor, because this is my kid.
Right.
It's my kid.
Yeah.
After all of this time in the oncology field, and my kid
Right.
gets cancer.
Yeah.
And I mean, I couldn't.
And you've said this before. You just wish it was you. You just
Oh,
want to take
in
it
a-
away and have it be you getting diagnosed.
100%. 100%, because I knew what to do.
Right.
I had seen all of this before already, so I knew what to expect. She did not.
Yeah.
And so I would have happily taken that on myself,
So what were the next steps from there? So was it the medical oncologist who confirmed that it was a positive cancer diagnosis?
Yes. Well, we got the report from the Integris. They gave us the pathology report.
Okay.
Gave it to us,
Yeah.
which there used to be, you couldn't get your pathology report. You had
Right.
to get it from your doctor. But because I knew those people and I had that connection, they gave us the report, and we knew what it was.
Is there a certain type of breast cancer that's associated with the mark on the outside?
It is. But typically it's inflammatory breast
Okay.
disease that does that. Jandy did not have that.
Okay.
So she had two, and I hope I'm remembering correctly, but she had two different pathologies. One said an PR positive
Okay.
cancer, and the other one said a PR negative. So I was lost when it
Right.
came to that,
Mhm.
because I wasn't familiar with
And
looking
you
at a
Google it, too. You
pathology
should
and
never
knowing what to
Google.
do.
You should
No.
don't do that.
No,
Yeah.
no, and I'm one of those believers that don't look
do
that up.
Yeah.
Yeah.
You'll find out more stuff than you need to know.
Google Doctor will give you 25 different
Yeah.
diagnoses.
Worst
Yes.
case
all at
scenario
once, yeah.
every time. Right.
But of course, I looked up inflammatory breast. Because the pathologist at Mercy, who did the ultrasound and the mammogram, said, "Oh my God, you have inflammatory breast cancer." That's what she said to Jandy. Which, I mean, bless her heart, I don't know why you would say that to a patient, but she did, And of course, Jandy doesn't know what it is,
Right.
I don't know what it is.
So you find out that Jandy has cancer.
Mm-hmm.
There's that emotional just
Jolt.
shock, jolt
Yeah.
for you. And then what's kind of the next set of emotions for you as a parent, and especially a parent who has experience in the field of oncology?
Well, then the switch flips and you shift gears
Mm-hmm.
into first gear
Yeah.
and you get going and you start talking about to yourself and my husband what we need to do, what we're going to do. And she was in such disbelief that this was happening to her. I did not flood her with all of that stuff. I just,
You're
in
on
my
the phone,
mind,
making
yes,
calls,
making calls,
decisions, right?
talking to people who could tell me what was the best way to do it. And I'm telling you, when we walked in to see the medical oncologist that she goes to now, which is Dr. Bova, I was ready for bear. I mean, I was going to say, you need to jump on this right now.
Mhm.
I'm ready, and let's do it. I don't want to talk about anything else. let's go. She did that for me.
I remember you saying to your first meeting with Dr. Bova, it was kind of later in the day, went into
It was in the
6
evening.
in the evening,
Yeah,
and she took hours to sit with you.
2 hours.
And
And she left us at 7:15 p.m.
Wow.
And she answered every question. She and I did not have to prompt her like I feel like I have to do a lot of times when it comes to stuff like that. I feel like I want to say, "Come on,
Right.
let's do this." I understand what you're saying.
which goes back to patient care, right?
Yeah.
That's best case scenario.
That's
you have
right.
someone patient with you who explains things to you
Yeah.
that you may not understand.
But Jandy she's so much smarter than me. And she has a memory like you wouldn't believe. So I knew that she would remember everything Dr. Bova said. And she did.
Yeah.
So I sat back in my seat and said to myself, you don't need to do this. You need to let her do this.
Mm-hmm.
She is in control of her health care. You're just the mother. You're not the intake worker. You are not the support staff. You're mom right now. And so I did it, and thank God she just took over and she asked questions. She knew what they said at the last appointment, and it was way easier. I was ready to fight, and
Yeah.
I didn't have to fight.
So initially you mentioned that you were thinking maybe we just have to do surgery, which for breast cancer is probably the least invasive. Only having to do a single modality, let's say you just have to do radiation, you just have to do surgery, that's probably the best case scenario from a treatment standpoint.
Right.
I think for Jandy, it seems like she's kind of had the worst case scenario in
Right.
terms of everything that she's had to do. When did you figure that out, and what was that process like?
Well, it was the first appointment.
Okay.
She said, you're going to have to do chemotherapy. Of course, she was following the guidelines that all medical oncologists follow. And you're going to have to, which was exactly what Dr. Toma had told me personally, that's going to be this, this, and this. But Dr. Bova was talking to Jandy. Dr. Toma was talking to me,
Right.
Personally.
Right.
Jandy wasn't there. But she said, I would recommend, surgery, chemotherapy, and radiation. And possibly some chemo after radiation.
All
And
of which she's either gone through or going through.
She's
currently.
gone through, yeah, she's finished everything. She just finished her last proton therapy treatment on last Tuesday, and so, which I think was the 7th. And then now she just has to do a chemotherapy infusion once every 3 weeks until March 26th.
Wow. So she will have been on chemo for a year?
Longer than a year.
Longer than a year. Wow.
Because I think she had her first treatment the end of November.
Yeah. And I think part of what I want people to understand is just how arduous that journey is. Like when you get diagnosed with breast cancer, and a breast cancer that's going to require surgery, chemotherapy, radiation, lots of follow-up appointments. I mean, I think we had a patient, Heather, that talked about
She was
going
on
to
this
the
podcast.
doctor. I mean, it was half the year. It was like there's 365 days in the year, and I probably had 180 doctor's appointments when you just literally add up the number of times that I walked into a medical facility. It's a tough experience.
It's a tough experience, and you get tired of that being your life.
Right.
I think Jandy, she loves her life. She always has. She has a great group that she works with at the salon. It's called Revelate. Her boss, who owns the place, is wonderful. I mean,
Great
they have
person for her to
support-
lean on, I noticed.
Yes, and has been supportive in every way. Her friends have been super supportive, but she would just sometimes she would say, I just want my life back. That's what I want. I want my life like it used to be, and I think people struggle with, succumbing is the wrong word, but saying to themselves, okay, it's either fight or flight.
Yeah.
You either ignore it and don't do anything, which we have seen patients that have chosen that. But if you choose to fight, then you may slip down and fall, but you get right back up. And that's what I'm for to Jandy.
Yeah.
And I think you find too, right? You never really go back to your old life or what was normal because you were
because
a
it changes you
completely
forever.
different person to your core after overcoming something like this.
Yeah.
Right.
And it has changed people in our lives. Some of our family members, that we used to not be, I don't mean when we weren't close, but we weren't in touch as often. Yeah. And now they're calling all the time saying, hey, how's it going? You know, just because we made that connection again, so it can do that too. But I think the hardest part for Chris and I both was just the idea, that your kid has cancer.
Yeah. And you went to a lot of the appointments. I mean, I think
all of them.
Yeah.
All of the appointments that she ever had, including chemo, I went to. And I was going to come to all of these. Of course, I'm 41 miles away. Yeah. But it was so simple for her. I mean, she'd go in.
You're talking about the treatments at the Proton Center?
The Proton Center treatments, these last treatments. The first time was tough. She has frozen shoulder, I think it's called. Okay. So she had a really hard time.
Limited mobility. And
the mobility is really, because she had 17 lymph nodes removed when she had her surgery. So it's a lot. Yeah. And that arm is sore, and it was hard to hold her. But that team helped her every day. She wrote such a beautiful thank you letter to them because they made, and I'll tell you, not only her journey easier, but I was comfortable with not worrying about it. Yeah. Think about it. You come to the front desk and it's Tessa and Cheryl.
You know them, right?
You know them, and they know you. Right. They know you.
I think that message that she wrote encapsulated everything that we at the Oklahoma Proton Center would hope that a patient would say about going through the treatment process. We have an incredible team there, an incredible group of clinicians and the people that sit at the front desk and everybody that's behind the scenes, all of the different departments, everything that goes into taking care of patients. And Jandy did such a beautiful job just talking about what it was like for a patient and what that relationship is like between the patient and the care team.
It's got to be validating for you too, because you didn't have a ton of interaction with the radiation therapists at the Oklahoma Proton Center when you were there. You're kind of more behind the scenes with us. We didn't overlap a lot, and knowing that they took care of your daughter the same way they would any other patient.
So Jandy couldn't come to the graduation today, but she wrote a letter to her team and to everybody at the Proton Center that I thought was really good, that you mentioned earlier. So I'm going to read it. I finished my radiation treatment last Tuesday, and I want to acknowledge my care team at the Proton Center. They were absolutely stellar in every way. I love those precious angels who were my techs. Like I love them, and I want to be their friend forever. These angels by name are Peyton, Katie, Stacy, and Jackie. They went above and beyond in every possible way, and I will miss seeing them and yapping with them every day. I'm so grateful for Dr. Story, who called me from his personal cell phone while he was on vacation to tell me my PET scan was all clear. You're a really tall doll baby, and I could squish you like Myra squishes the squirrel.
This must be an inside joke, right?
Yes.
I have no idea what that means. That's not the only thing I don't know what means in here. My absolutely amazing nurse, Sarah, who I could also squish in the same manner. To the ladies at the desk, Tessa and Cheryl, you were light and love every time I walked through the front doors. I learned to love my career from the front desk of a salon while gritting my teeth at the inconveniences of reception service. I'm humbled and awed by the way you do your jobs. It's something I will learn from and teach from forever. And Carrie, over there dealing with the insurance bullshit, winking at me and letting me know it will all be okay. Don't get me wrong, I'm so happy to be done with this course of my treatment, but I will love you all for the rest of my life. 10s across the board. To David and Heather and Devin, you can never truly know what your care and kindness has meant to me and my family. I want to thank all of you for showing up every day and making your patients feel like people.
That's amazing.
It is amazing,
so
and
much.
it's true because that's what's important when people come to a health care facility is make them feel like they're a real person.
Yeah.
And I think we don't do that enough out there, not at the Proton Center.
Well, and it's got to be. I think it's probably a little bit nervous. You know, you're bringing your daughter into the place that you used to work. You know,
Right.
It's like, hey, I hope this all goes well. And obviously, the team is fantastic, and
It's
they do
fantastic.
an amazing job. But it feels different when it's your family member.
It does.
that's
It
going
does.
through it.
In fact, when I brought her for her first treatment,
Yeah.
I go to the door, that leads from the lobby back to the treatment room, and Jackie, who was new, did not know me from Adam.
Oh, right.
So I'd start to go in the door. She doesn't know that I know I can't go back to the treatment room. And she said, it's just Jandy.
Yeah.
And I'm like, I know.
Yeah.
Because she started after you had already retired,
Yeah.
right?
Yeah.
Jackie did.
Yes,
Okay.
I didn't know her.
I'm
Yes.
Sharon.
I'm like-
yeah.
I'm a legend around
Yeah.
here.
And
You know
of
Sharon?
course, in my brain, I'm trying to figure out the appropriate way to act because
Right.
I know I'm not supposed to go back there.
Yeah.
And so I'm kind of stammering around, and finally I'm like, I know you're new, but
Yeah.
I'm old.
Yeah.
And then I just stopped
Yeah.
because I was so nervous, I didn't. So I just went and sat down.
Yeah. You got to learn all the rules
Yes,
now. I mean,
all
you were
over
on,
again.
You were on the backside of it. Yeah.
And David, another thing I wanted to say was that Jandy getting her chemo treatments, she had a lot of nice people take care of her.
Yeah.
She never had that kind of connection.
Yeah.
As she did with her team at the Proton Center.
That's correct. Every time they would access her port, that was the reason why I had to go with her, because she was terrified because she had a horrible experience, one horrible experience of a new nurse that could not, and she kept sticking her, So anyway, we grip her hand, and wait till she gets all settled, and then after they get that part over, then she's good.
Yeah.
So we sent Chris one time because I had a doctor's appointment or something that I couldn't change. And so he goes and he said, Mom says I'm supposed to hold your hand when they stick your port, So she said, that's right. So he holds his hand, and so it goes all well, and she goes, okay. She said, okay, Dad, you can go. He said, okay, well, I'll see you later.
Yeah. Yeah.
That sounds like Chris.
That was
Okay, yeah.
He made it through. He had to get up to go in there.
He needed
Yes.
a break.
Yeah.
Yeah.
What? Well, and I do appreciate Jandy working Heather and I into the shout out or the letter there. That's not why I asked you to read it.
No.
So-
It feels like such a small thing compared to what the treatment team and
Yeah.
Well,
for sure.
staff at the Proton
Yeah, but
Center do. We're
but
just
if it wouldn't
a
have
friend
been,
to you. And
I know, but if it wouldn't have been for y'all, in a lot of ways that I won't talk about, that it would have been harder.
Yeah.
I wish that everybody who has to go through something like this would have people in their lives that they could count on and depend on to help them, like real friends are supposed to do.
What advice would you have for another mother who's having to watch their daughter or son go through cancer treatment?
I would say don't try to take over. Don't try to run the show. Let your kid run the show because they can. Mm-hmm. Now, I'm not referencing little kids. I'm talking about, adult kids who
trust that they're going to make the right decisions for themselves.
You have to, and just be supportive.
Right.
Just support them in whatever decision they make because it is their life and they are smart enough. You don't think they're smart enough to do it by themselves, but they are. And they can do it. And so not only will it take the weight off of you having to make all these decisions, but it helps them to take control of their lives, to take control of their treatment,
right.
To be responsible for everything they're supposed to do. I didn't have to call Jandy and say, don't forget to put your jeans cream on today, or don't forget to put your cream on your port. I didn't have to tell her that because I sat back in the chair while Jandy and Dr. Bova talked to each other and said, Dr. Bova said, now this is what you have to do. Mm-hmm. And Jandy said, okay, and I think that that's the best advice I would give any parent. No task that you do for them is too small.
Right.
Yeah.
If Jandy's at work and her shoulder's been killing her, I'll call her and say, hey, I'm going to go over to your apartment and change your sheets, wash your towels, just get things that I know that will hurt her arm.
Right.
So things like that. Even go and feed the cats or sweep or mop
right.
Right.
Anything,
right.
Nothing is too small to do for them. Nothing is too small.
What is next for Sharon Followill? I know that Heather and I are trying to talk our work mom into coming back and helping us for a little bit at the Proton Center. And we may be able to convince you to do that a little bit. But what else for you? I mean, I know there's still some treatments with Jandy and you guys are working through that. But just as a family, kind of what are you hoping that the next year looks like?
Well, I don't know. My youngest lives in Rogers, Arkansas. Jandy lives here, of course. And then my boy, Christopher, lives in Nashville. So I don't know.
Traveling, right?
I'm just well, when I first retired, I went on all these trips. I went on a trip with my sister. I went on a trip with my best friend from high school. I mean, I just did all the things that I wanted that I couldn't usually do because I was too busy, But then after that, I'm like, okay, now what am I going to do?
Right.
Because, it's just me and Chris. How clean can you get your little tiny house, So this is the perfect thing for me because I can also say.
Podcast guest.
Yeah.
Podcast guest. I could do that.
Yeah.
I don't know. I think I'm going to like working. I think I would enjoy that field.
Yeah.
I think about too when you were starting to consider
Retiring.
going into retirement and you had almost like a gut instinct saying it needs to be at this time. And then, so you did retire and traveled for a little bit, but then Jandy was diagnosed and you had all this time to be there for her and to take her to appointments. It was almost like this. You can't even explain it, but something inside you was saying, okay, it's time. It doesn't have to be forever, but I think right now is the time to retire.
Yeah.
And it's always crazy to me how things like that work out, right?
Yeah. Well, there's not many people in the world. I know some people in the world enjoy working all the time.
Right.
But most people work for vacation. I mean, I remember when y'all first came back from Knoxville and Tom said, why do you want to work at the Proton Center? I said, the same reason why I want to work anywhere.
Yeah.
Is so I can go on vacation.
Fair.
Let's be honest. If I can help a lot of people when I'm working
in the process, right?
Then that's what I want to do.
Yeah, yeah. Well, I Thank you so much for taking your time, Sharon, and just being willing to talk about your family experience with your mom and then with your daughter. And thank you for everything. There's not many people like you, and there's not many people that could handle the job the way that you handled it, with all of the patients calling into the Proton Center and you helping them navigate that process or that journey. And so thank you for coming on with Heather and I today.
Sure. I got one more thing to say.
Yes, say it.
Get early screenings.
Yes.
Get early screenings because they can make a big difference on how you live the rest of your life.
Early detection saves lives.
Yes.
Amen to that. That is a great way to close out the podcast. So thank you. Thank
You're
you so
welcome.
much, Sharon.
Love you.
Love it.